Hi everyone, in this video we'll discuss something regarding the pharmacology. So we'll discuss the definition of pharmacology and two main branches of pharmacology and various branches of pharmacology we'll discuss. Okay, so here coming to the pharmacology, it comes from the two main Greek words. Those are pharmakon and logos. So here pharmakon means what? Drug. So logos means what? Study. Means what? Pharmacology is the study of scientific study of the drugs. Okay, so here coming to the definition. So what is pharmacology? Pharmacology is the study of effects of the drugs on the body and body's response to it. And what is effects of the drugs of the body? Effects of the drugs is considered as pharmacodynamics, and body's response is considered as pharmacokinetics. Mean what pharmacology means? The study of pharmacokinetics and pharmacodynamics of the drug. Okay, so in other words, a pharmacology is the study of the study of the origin of the drugs, nature of the drugs, and properties of the drugs and effects of the drugs. Okay, so then we'll go on move on to the divisions of pharmacology. So there are two main divisions for the pharmacology. Those are pharmacokinetics and pharmacodynamics. Okay, here coming to the pharmacodynamics. So what is pharmacodynamics? Pharmacodynamics, which deals with the drugs, what drug do to the body, D and D simply. Okay, so what drug can do? So dynamics means what? Dynamics means energy. What drug can do? It shows the effects and through its by acting on its target. In simple terms, what drug can shows the effects on the body and by acting on its a corresponding target. So it includes the mechanism of action of the drugs and effects of the drugs. Mechanism of action of the drugs at subcellular level, organ level, and biochemical level. So we'll see one example for the pharmacodynamics. We'll see the pharmacodynamics of captopril. Okay, so coming to the pharmacodynamics of captopril. So captopril is what? Captopril is an antihypertensive drug. What it do? It lowers the BP. So how it lowers the BP? By inhibiting the enzyme angiotensin converting enzyme. So what is pharmacodynamics of captopril here? It lowers the BP and it inhibits by inhibiting the enzyme. So this is what the pharmacodynamics of the drug. So what happened when the angiotensin converting enzyme is inhibited? So angiotensin 1 is not converted into the angiotensin 2. So when the angiotensin 2 is not formed, so there is no vasoconstriction and there is no aldosterone level, thereby it lowers the BP. Okay, so this is about the pharmacodynamics. So then we'll move on to the pharmacokinetics of the drugs. So what is pharmacokinetics? Pharmacokinetics means what body do to the drug. So what body can do, which can show body can absorb the drug, body can distribute the drug to the site of action, body can metabolize the drug, and body can excrete the drug. So what happened when the drug entering into the body? So it can, if when we take a tablet, it will enters the GA tract, from where it is absorbed into the bloodstream. So after entering into the bloodstream, it can either bind to the plasma proteins, depends upon their affinity, uh, and then it can distribute to the various sites, including the site of action, and uh, through that path it will enters the liver, where either it is converted into the active form, or where it is converted into the inactive form, and then finally it enters the kidney, from where it is excreted. Okay, this is what body do to the drug. So this is what pharmacokinetics. So we'll see one example. So here paracetamol. What is paracetamol? Pharmacokinetics we'll see. So when we take paracetamol, it is completely absorbed by the oral route. From that, after entering into the bloodstream, 20% of the drug bound to the plasma protein, and it is metabolized by the liver by the conjugation reaction, either by the sulfation or by glucuronidation, and it can excreted by the kidneys. So then we'll see another branches of the pharmacology. Okay, so what are the other branches? Toxicology, clinical pharmacology, chemotherapy, and pharmacotherapeutics. Okay, so what is toxicology? Toxicology is the study of poisonous effects of chemicals. So chemicals, here the chemicals means either it is a drug or it is a household products, or it is a poisonous effect, so organophosphates, or it is a pesticides, whatever. Okay, so whatever the chemical uh, it is. Okay, study about the poisonous effects of the chemicals on whom, on the living organisms, so whatever on the animals or on the human beings. Okay, then so not only we study the effects of the poisons, so we can also identify the toxic substance and its mechanism of action, and we need to identify the complications of that particular toxic substance, and we need to develop the treatment for that poisonous effects. So we can identify the toxic substance, we can identify the mechanism of action, we need to assess the risk, and we need to find the treatment for the poisonous drug. Okay, so then we'll see another definition, another branch of pharmacology, that is clinical pharmacology. So what is clinical pharmacology? Clinical pharmacology is the scientific study of the drugs in human beings. Okay, so what we study in human beings, what regarding the pharmacokinetics and pharmacodynamics and adverse effects of the drug. Okay, so how, why we need to study these the about the drugs in human beings? To assess the risk, so to assess the safety and efficacy of the drugs in our patients. Okay, so then we'll move on to the chemotherapy. So what is chemotherapy? Chemotherapy is the treatment for systemic infections and malignancies. So here systemic infections means either fungal infections or bacterial infections and protozoal infection. So it's the study of treatment of all these infections and cancer. With what? With the help of a particular drug, so that can selectively inhibits the infective organism. So for example, if the one person is having TB, so we can give the drug that can kills the TB bacteria only. Okay, so that can kills the bacteria only, not the human cells, not the host cells. Okay, so if any person is having cancer, we should give the drug, we should give anti-cancer drug, so that anti-cancer drug can kill only the cancerous cells, not the normal host cells. Okay, this is what we study in chemotherapy. So then coming to the pharmacotherapeutics. So in the pharmacotherapeutics, we can study what is pharmacotherapeutics. Pharmacotherapeutics is the application of the drug related information and disease related information for effective treatment. Okay, so here it involves the selection of the particular right drug, right dose, and for a appropriate duration to achieve desired clinical outcome with minimal side effects. Okay, so here also we can study about the drugs, where in the pharmacotherapeutics also we can study about the drugs, in pharmacology also we'll study about the drugs. So in pharmacology, what we study how the drugs works in the body, and what are the pharmacokinetics, and what are the all we can study all the available drugs for the particular condition. For example, hypertension, when we take hypertension, so in pharmacology we will study various classes of all the classes of antihypertensive drugs. Okay, so in pharmacotherapeutics we can study about how the drugs are used to treat the disease. So from the pharmacology knowledge, so we can choose an appropriate drug for treating the disease. Okay, so how can we select? Depends upon the safety, depends upon the tolerance. Okay, depends upon the side effects it can produce, depends upon the toxicity it can produce, and depends upon the um, effective outcome. So depends upon that we can choose a particular drug for treating the disease. So this is what we can study in pharmacology. So this is about the introduction regarding